So in this video, let's talk about Parkinson's disease. So Parkinson's disease is something that we have to know, at any cost. Whenever we see any patient coming with these symptoms, we have to know that this patient is suffering from Parkinson's disease. The clinical features are very clear and we have to know all of those. So what causes Parkinson's disease? So there's something called substantia nigra in the basal ganglia of your brain, alright. So this substantia nigra, the nerves running through this structure are responsible to produce dopamine. Okay, so because there is insufficiency in this area, as you can see here, the substantia nigra is very much reduced, right? So therefore this is going to reduce the production of dopamine. So dopamine helps with your movements, okay, in any person, in you and me also. Dopamine is what helps in the movement of us, right? So because there is reduced dopamine in these patients, there is going to be all these different kinds of symptoms. So the symptoms are going to be resting tremors. Resting tremors is when the patient is at rest, he's not doing anything with his skeletal muscles, and yet he's going to have these tremors. Okay, just imagine a patient sitting with his hands on his laps and yet he's having these tremors. Okay, rigidity, that is the patient is rigid, he's not able to move his different parts of his body freely. Bradykinesia, brady is nothing but decreased and kinesia is movements. So because of decreased dopamine, the patient is going to have decreased movements. Okay, decreased movements is nothing but decreased is brady and movements is kinesia. Okay, and the patient is going to have festinating gait, that is he's going to have an abnormal gait. Okay, when he is walking, you'll clearly know that he's not walking normally, he's having this abnormal gait. The patient is going to have difficulty in balancing and he's going to have mask-like faces. Okay, so the patient is going to be expressionless. So when you see the patient, he's not going to have any expressions on his face. So that is nothing but mask-like faces. So you can see how in this video, this patient is having mask-like faces. He's not having any expressions and he's having these tremors. And in this patient, we can see that he's having an abnormal gait. He also has this stooping posture. So if you can see again, he's stooped, right? His posture, it's like he's having a stooped posture. So that is also a classic sign of Parkinson's disease. So again, we can see that he's having this abnormal gait. All right. So these are the clinical features of Parkinson's disease. So the main things that we have to remember are resting tremors, any abnormal gait, rigidity and bradykinesia. Okay, cogwheel rigidity and bradykinesia. So the resting tremors are also called pill rolling tremors because when he is having these tremors, it will look like the patient is rolling a pill with his fingers. Okay, so these tremors are also called pill rolling tremors and he's going to be expressionless, that is he's going to have mask-like faces. So how do we diagnose this condition? So the diagnosis is mainly clinical. So whenever you see any patient coming up with these symptoms, you have to think about Parkinson's disease. Okay, so the most patients will have a clinical diagnosis. But if you're highly suspicious and if you want to confirm the diagnosis, you do something called a SPECT, which is also called DAT. So SPECT is nothing but single photon emission computerized tomography, and DAT is nothing but dopamine transporter scan. So what this means is this is a type of PET scan. Okay, so computerized tomography. So CT scan, single photon emission CT. That is nothing but PET CT scan. So this scan is gonna show how much dopamine is being taken up from the brain. All right. So that is gonna show how much dopamine is reduced in these patients. And when you confirm the diagnosis, you start treating the patient using dopamine. Because this patient has reduced levels of dopamine, you give him dopamine, right? So levodopa and carbidopa. And the second line treatment is MAOB inhibitors. So it is nothing but monoamine oxidase B inhibitors. So what these do is they reduce the uptake of dopamine. Okay. So because of that, there will be increased dopamine levels. And dopamine agonists such as pramipexole and ropinirole and amantadine, which also increases the dopamine levels in the body. So just imagine a patient presents to you with complaints of dyskinesia. So dyskinesia is nothing but dys is extra, very much increased or abnormal movements. Okay, so abnormal kinesia. This will be most likely due to levodopa. Okay, so you're giving him, first of all, the patient had bradykinesia. He had very much less reduced movements, and then you give him some dopamine, right? So this dopamine is going to increase the patient's movements, right? So when there is increased too much of dopamine in his body, he's going to have increased or very much abnormal movements. That is dyskinesia. And if the patient complains of bradykinesia or more rigidity, then that means the patient is having worsening Parkinson's disease. So the Parkinson's disease is not improving with the treatment, right? So his disease is just worsening. So that is all about Parkinson's disease. Thank you.